Welcome to the Mindful Practice Podcast, a space for physicians navigating burnout, identity shifts, and career change without pressure or judgment. I'm your host, Dr. Bertina Hooks, a board-certified internal medicine physician, coach, and writer. Here we talk honestly about what it means to build a sustainable career and a life beyond medicine and survival. Hello, and welcome to the Mindful Practice Podcast. I'm your host, Dr. Bertina Hooks, a board-certified internal medicine physician, author, coach, and entrepreneur. Today, on this episode of the Career Clarity and Pivot series, we're going to be talking about one of the biggest myths in medicine, that you only have two choices. Today, we're going to be exploring different career pathways. And unless you know the options that are out there, you won't be able to have the clarity to determine which pathway is correct for you. You'll either stay exactly where you are, or you can completely walk away from medicine. Those are the two options that we usually are aware of. But honestly, that's one of the reasons so many physicians feel trapped. Because when people believe that they only have two options, clinical medicine and practice or non-clinical, they often feel powerless. They tell themselves, I've invested so much in my education and training. I've worked too hard for this degree. I don't know how to do anything else. If I leave, I failed. But I want to challenge that thinking today, because I don't believe physicians only have two choices. And I am an excellent example of that. And I have interviewed many other physicians who are doing similar things. We do not only have two choices. I believe physicians have options. I believe physicians can evolve. We just have to give ourselves permission. I believe that physicians can redesign their careers. And most importantly, I believe that career pivots do not have to be impulsive, reckless, or all or nothing. In fact, I think the best career pivots are strategic. They're intentional. They're thoughtful. And they are built around the life you actually want to create. So this episode in the series is built around the Phoenix Position Pivot Framework. And you can find a copy of the framework on my website, pinnaclebusinessacademy.org, and we'll have a link for it in the show notes. So far, we talked about fire, recognizing that something is no longer working, clarity, defining what you actually want, position, learning how to communicate your value and strategically position yourself for opportunity. Today we're talking about pivot, and I want to make something very clear. A pivot does not always mean leaving medicine. Sometimes it means redesigning your relationship with medicine. You don't have to burn your life down. I think social media has created a dangerous narrative. People quit their jobs, they move to another country, they launch a business, and 6 months later, they're supposedly making millions of dollars. Most real-life transitions don't work that way. Most physicians have mortgages, children, student loans, responsibilities, aging parents, financial obligations, and that's okay. I actually encourage physicians not to make emotional decisions. I encourage strategic decisions. You do not have to burn your life down to build something better. You can test. You can explore. You can learn. You can diversify. You can gradually create options. Optionality. One of my favorite words is optionality, because optionality creates freedom. The more options you have, the less trapped you feel. Optionality may mean keeping a part-time clinical practice while doing consulting, working in utilization management while building a business, doing telemedicine while writing a book, practicing clinically while serving as an expert witness, having multiple streams of professional identity. I think physicians were trained to think in very linear ways. Go to college, go to medical school, go to residency, then possibly fellowship, and get a job. Stay there. Work your entire career there, and eventually retire. But I don't think modern careers work that way anymore. And honestly, I don't think they should. I'll give you an example. As I was doing my transition, when I was experiencing burnout in 2016, I started to explore locums first. Then I started exploring with my own primary care practice, which I started in 2016. So I went from being an employed hospitalist and then started doing locums on the side. Then I utilized that locums income to create my own primary care practice because I wanted autonomy and freedom, and both of those options provided that at the time. Then after I had successfully launched a medical practice, I decided I wanted more. So I started looking into non-clinical work in 2019, just before the pandemic started. I was also doing administrative work, working as a center medical director for a major healthcare organization, and I decided that I wanted more freedom. So I went back to locums during the pandemic and started to explore non-clinical pathways like utilization management and medical expert work. I also explored pharma. And exploring those different options and industries allowed me to realize that there's a lot of possible options for physicians, and we are not limited. It all depends on your growth mindset. Now I have a hybrid career or portfolio where I work as a utilization management medical director. I also do medical expert work and consulting, and I also am an entrepreneur where I've built different businesses, including a medical practice. All of this, it may seem impossible because of the fact that I'm juggling multiple different roles, but what I've realized by doing a hybrid role is that it creates multiple streams of income, multiple ideas of flexibility and autonomy for me, and that is fulfilling and sustainable. There's not one size fits all for every physician. That's why you really have to explore and get clarity before you pivot. So let's talk about some common career pathways that physicians can explore. Utilization management, which is a great option for physicians who enjoy systems thinking, policy, and remote work. Telemedicine offers flexibility and geographic freedom. Consulting. You can help organizations solve healthcare problems. I did that for a number of years as a hospitalist consultant, helping build practices, finding out the different operational problems, and finding solutions to them. Medical expert work, reviewing cases and providing medical expertise in legal settings. Medical affairs and pharma, combining medicine with education, science, and industry. That's an excellent way to use your medical knowledge to educate key stakeholders, patients, about medical problems, issues, diagnostic studies, and treatments. And medical affairs doesn't just exist in pharma. It also is a important role in utilization management as well. Entrepreneurship, building businesses that align with your values and interests, such as a health startup company or a private practice, whether it be a private practice model, a DPC, direct primary care, or concierge model, a telemedicine model, the developing medical devices. The possibilities are endless in entrepreneurship. They could also include real estate and other entrepreneurial pursuits. Coaching, helping other physicians navigate the challenges you've already overcome. And then finally, there's portfolio careers, which is my lane, combining several professional interests into one sustainable career. But here's what I want you to remember. There's no universally perfect pathway. There is only the pathway that aligns with you. First of all, I want to say that you need to stop comparing yourself to other physicians. Comparison creates confusion. You see another physician making $1 million in coaching. Someone else is opening a med spa. Someone else is doing pharma or real estate. Someone else is traveling the world doing locums. And suddenly you think, maybe I should do that. But career decisions should not be based on envy. They should be based on alignment with your core values and beliefs. Ask yourself, does this fit my personality? Does this fit my lifestyle? Does this fit my strengths? How does this fit the future that I want to build? Not every opportunity is your opportunity. And in order to realize that, you need to get clarity. Some of that clarity may come from your own research, but you also may need a coach to help you with that research. And that's where a clarity call really comes in handy. I'll tell you more about how you can schedule your next clarity call with me at the end of the podcast. Finally, it's important to test before you leap. I cannot emphasize this enough. It's important to explore and try out different possibilities before you definitively pivot. Have informational interviews, attend conferences, network with other physicians in the industries you're interested in, shadow or per diem work, volunteer, do a small consulting project or a small locums or UN project. Write articles, speak, launch a podcast. But it's important to build gradually. Many physicians think they need absolute certainty. And there's a lot of fear sometimes associated with uncertainty, which I understand. But often clarity develops through action. So it's important to explore and test out these pathways to see if they are a good fit for you. The next thing I want to talk about is how your medical degree is an asset. I want physicians to stop thinking that pivoting means wasting your education. Nothing could be further from the truth. Your degree taught you leadership, communication, resilience, critical thinking, decision making, systems analysis, and crisis management. Those skills can transfer into different roles. You are not starting over. You're building on a solid foundation. I want to leave you with a few questions. What career pathway have I been curious about exploring? What assumptions about my future am I holding on to that may no longer serve me? What kind of life do I actually want my career to support? What small experiments or tests could I try over the next 90 days? Am I making decisions from fear or from alignment? These are important reflection questions for you to consider when you're exploring different career pathways. It's important for you to see what your values are, do a values energy audit, and you can also do research with informational interviews, networking, and testing out different industries on a trial basis to see if it's a good fit. I have developed an AI tool that will allow you to determine which top 3 career pathways are the best fit for you based on an assessment. So you'll answer questions, and then the AI tool that I've designed will allow you to determine what 3 career pathways are best for you and how to optimize your CV, your LinkedIn profile, and strategically position yourself to land those opportunities. If you want to learn more about it, go to my website, pinnaclebusinessacademy.org. If today's conversation resonated with you, I want to invite you to continue this work through Pinnacle Business Academy. Our career clarity and pivot intensives are designed to help physicians gain clarity, strategically position themselves, explore career pathways, build visibility, strengthen networking, optimize your personal professional brand, and create intentional career roadmaps. Because I truly believe physicians deserve more than survival. They deserve options, they deserve alignment, and they deserve careers that evolve with them. Thank you so much for joining me for today's episode of the Mindful Practice Podcast. Next week, we're going to talk about one of the most overlooked aspects of reinvention, the mindset required to evolve. We'll discuss fear, perfectionism, identity, confidence, and why so many physicians stay stuck even after they know what they want. Until next time, remember, you are not trapped. You have options. You are allowed to evolve. Take care. Thank you for listening to the Mindful Practice Podcast. If today's episode resonated with you, you can find free burnout and career clarity resources at pinnaclebusinessacademy.org. And if this podcast supported you, please consider subscribing or sharing it with a colleague who might need it. Remember, you are more than your white coat. You are not broken, and you are allowed to evolve. Until next time, take care of yourself, not just your role.